Hi everyone, welcome to Infinite Women. I'm Allison, and today I wanted to talk about Polycystic Ovary Syndrome, or PCOS, because as many as 1 in 5 people with ovaries experience this, but as many as 70% don't know they have it. I had never heard of it until my own diagnosis when I was 29. So just to be clear, I am not a medical professional in any way, and this is not meant as medical advice, just information and my own experience. So first off, what is PCOS? Despite the name, people with PCOS don't necessarily have polycystic ovaries. So it's normal to have some cysts on your ovaries, but polycystic means there's more than usual. So I do, but if I had my ovaries removed, for example, my PCOS wouldn't go away. Believe me, I asked. There are 2 other major indicators of PCOS. The first is irregular or absent menstrual periods, though some people have heavy, long, and or painful periods. And I think this is one of the reasons that it doesn't necessarily get diagnosed, because you're not going to find out about the cysts on your ovaries unless, for example, you have a transvaginal ultrasound like I did. Super fun. But so many people with ovaries have irregular periods, and medical science doesn't really seem to care that much about medical issues that primarily affect women. So there are a lot of causes, and it's very common for doctors to just say, okay, well, I guess that's a thing that you're going to have to live with, and they don't dig any deeper. So anyway, the third type is signs of high androgen. So these are sex hormones and particularly high testosterone. Things like excess facial or bodily hair, loss of head hair, and acne or oily skin. So I do have heightened testosterone, but I'm lucky that of those, I only have excess facial / bodily hair, but that could also just be genetics if we're being honest. My period was always irregular in my teens until I started taking birth control, and then they stopped altogether once I got my birth control implant, which I've been using for about 10 years now. Specifically, I've got Implanon, the one that goes in your arm. Speaking of birth control, PCOS is a leading cause of infertility, which wasn't an issue for me, but obviously is something that would be relevant for a lot of other people. So my diagnosis is a little roundabout. Back in 2018, when I was 29, I developed a weird skin discoloration on my arms called acanthosis nigricans, if you want to go Google it. A female doctor took one look at that and signed me up for a transvaginal ultrasound to check my ovaries. Now, this brings us to something that is really important to understand. PCOS can mess with all sorts of things in your body, not just your hormones. In my case, the skin discoloration was actually a sign of insulin resistance, which is one of the common issues for people with PCOS, along with things like high cholesterol, which I also have. So I am pre-diabetic, and I avoid that developing into diabetes by basically doing what people with diabetes do in terms of diet and taking metformin to regulate my insulin. So as I mentioned, one of the other ways that PCOS impacts my body is that I've had issues with high cholesterol since at least my mid-20s. It is under control, but I think it's important to share that when I first got it checked, because my mom told me that we have a family history of high cholesterol, my male American doctor didn't stop to question why an otherwise apparently healthy young woman would have high cholesterol. I distinctly remember asking him, okay, what do I do to keep this in check? And I was basically already doing the things that he suggested. Don't smoke. I have literally never smoked. Drink less alcohol. I don't drink any. Eat less red meat and dairy. I already wasn't consuming that much. Like, there was some in my diet, but not a huge amount. And then exercise more. Okay, what kind of exercise? He didn't know. How much per week? He didn't know. Then this idiot told me that I could lose weight, which, apart from the fat phobia, is pretty concerning because it means that this man apparently got a medical degree without learning the difference between correlation and causation, meaning that just because 2 things occur together doesn't mean that one causes the other. It apparently didn't occur to him that if someone was eating a lot of red meat and dairy, smoking, drinking, and not exercising, that changing those behaviors would lead to weight loss for a lot of people. There's also a big difference in a doctor telling you to eat more of this or less of that, or increase your cardio, or other specific advice versus just telling someone to lose weight. And the irony is that PCOS can make it harder to lose weight, full stop. And just for reference, this is basically what I looked like at the time. So this is the body that he was judging. If anything, I may weigh a little bit more than I did 10 years or so ago when this was happening. But just as a visual reference for how fat or not I was at the time, this is basically what I would have looked like. So if this male doctor had bothered questioning why I had high cholesterol when my lifestyle didn't match the risk factors, I could potentially have been diagnosed years earlier. Instead, he saw a woman that, in his opinion, should lose weight, and that's all he saw, rather than a woman in her mid-20s who was otherwise healthy and whose lifestyle didn't match her diagnosis. Speaking of weight, however, weight gain, particularly around the belly, and obesity are associated with PCOS. Other risks include high blood pressure, cardiovascular disease, metabolic steatohepatitis, which is where too much fat develops around your liver and causes damage, sleep apnea, abnormal growth, and increased cancer risk on your endometrium, the inner lining of the uterus. The diabetes and high blood pressure can also particularly be of concern if you are able to get pregnant. You can also develop secondary issues, so my prolonged metformin use means that I am now dealing with a B12 deficiency. One option, ironically, is to eat more red meat and dairy to increase my B12 intake. So overall, I consider myself pretty fortunate that my PCOS doesn't seriously impact my daily life. But that's because I was able to get an accurate diagnosis before things got really bad, and because things like my body hair or not being able to get pregnant don't really affect me. If I hadn't developed that skin discoloration and had access to good health care where a doctor knew to connect those dots, I could be a lot worse off right now. I could have had another doctor who saw an indicator of insulin resistance and, like with the cholesterol, assumed that I should just lose weight. Research has shown over and over that women and racialized minorities are less likely to get quality care than white men because of ingrained biases on the part of many medical professionals. And I do have a whole other podcast episode where I talked with Alexis Pedrick about medical racism, if you want to go check that out. And that's not even getting into weight-based biases. So if any medical professional tries to ascribe the BMI to you as an individual, I personally would not trust that person's judgment, but that is a whole other video. All of that is to say that, unfortunately, you may have to be your own healthcare advocate if you don't feel you can rely on your doctors, and that means being informed. If you want to know more, there are a lot of reliable sources of information out there about PCOS and related conditions, but please make sure that you're reading content from real medical sources and not randos on social media and Reddit. And that's all I've got for you today. Join us next time on Infinite Women, and remember, well-behaved women rarely make history.